I'm constantly haunted by what's going to happen when there's no more coverage. What's going to happen if I have no more job that provides the insurance? What's going to happen when he hits the next cap and can't access the medication, can't access the treatment? That to me has been the hardest part.
When we found out we had a lifetime cap, I sat in the car and cried because I knew we were going to hit it and I didn't know how we were going to survive and how we were going to pay for all of this. So it's constantly having to think ahead 3 steps and trying to figure out what is our next option to be able to provide care for our son.
We knew that if something didn't get passed, we were going to be in a lot of trouble. Our Constitution and the founding documents of our country talk about life, liberty, and the pursuit of happiness. And without health, you can't have any of that. So the Affordable Care Act has improved our quality of life. Knowing that we don't have to deal with the cap anymore means that we can focus on the best care and the proper care for his condition. He's going to get the care he needs. He's not going to face the complications that arise from not getting treatment that could endanger his health or even his life. Before, when we were dealing with the cap with my son, $1 million cap may seem like a lot, but when you have significant health care costs, cancer or MS, or in our case hemophilia, you can burn through that pretty quickly. It was maybe $1,000 worth of the medication a couple of years ago. Now it's about $3,000 a day. That cost increases every year. This is not an issue that's really confined to families like my own with kind of crazy, chronic, serious issues. It's something that runs across the entire fabric of society. Every kind of family, every kind of town. There's somebody who's got some kind of problem, and hopefully a lot of the protection issues in the Affordable Care Act are going to give them some benefit.
When we found out that Chris could possibly be covered under the Affordable Care Act with health care reform, I was thinking, oh no, that's not going to pass, And then I was like, oh my goodness, it happened. It really happened. When we saw some of the things that would impact us immediately, like him being able to be back on our insurance policy up to age 26, it was just a major relief.
One of the biggest proportion of people who are uninsured
are young adults like you who are making the transition from college to their first job or to a graduate degree.
And the fact that you guys are able to stay on your parents' health insurance
up to the age of 26 obviously makes a huge difference.
I just see this plan as allowing me to kind of continue my education and just kind of absorb as much information as I possibly can.
My doctor had said to me when I was diagnosed with cancer, it's either going to be you're going to have to go into your retirement fund or you're going to die. Those are your choices. When that was signed, I mean, that just changed my life completely because then I knew I could get the treatments and I would be okay.
I want to thank you so much.
Because if it wasn't for you, I probably wouldn't be here right now. And that's from the bottom of my heart.
Look, it means so much.
You had trouble buying health insurance before the pre-existing condition fund got set up, is that right?
Right, I couldn't. There was no way I could. I was denied.
It's still a battle that you're fighting, but now you've got some allies on your side, and you don't have to spend all your time worrying about paying the bills. Michelle and I are thinking of you, and I really appreciate you being willing to tell your story because
I think what happened to you and your family can happen to anybody, and that's sort of one of the main messages that we want to deliver to people.
Yes, exactly. You're right.